welcome to my channel. I'm Liz. If you are wondering what you need to wear for either your first nursing job or you're going into clinical or you're already a nurse and you're just kind of like, I'm not sure what to bring with me when I go to work, this video is going to be for you. I'm Liz. I do videos on my journey to becoming a nurse practitioner. I've been a nurse for 5 years, so I can share tips and tricks on how to survive in the nursing world, as well as daily lifestyle vlog, that type of thing. So if you're interested in that, make sure to subscribe below. And let's get into my 10 must-haves when you are going to be a nurse on the floor. Number 1. So first I want to talk about clothes, what you're going to wear on your body to make your job easier, because good Lord, it is hard enough without anything. So we'll start and we'll go from the bottom up. So number 1, you're gonna want shoes that are gonna be supportive. And the part that stinks about this is they're not gonna be cheap. But good news, if you find ones that are high quality, you're gonna pay a little bit more money, maybe like $150, something initially. Those are gonna last you a really long time and they're gonna protect your feet from all the gross things in the world. In a shoe, you're gonna wanna find something that has really great support, otherwise your back and your legs are going to want to murder you. So I absolutely love Danskos. They are these. You see a lot of medical professional people wearing them. They are not the cutest things, I admit. However, they provide great arch support. They make your posture a little bit taller so you're not hunching over without even realizing it. They are very wipeable, so that's a huge thing you're gonna wanna find in shoes, is something that you can wipe the gross off of. I wipe down the bottom of mine usually before I go home. You get stuff all over the top of them. You don't want shoes with like fabric on it, like sneakers, something like that's really porous, because you're gonna get it on whatever it is on your sock, and you don't want that on your sock, I promise. That is really important. You're gonna need something that you can move pretty quickly in, but the big thing is just support. You need something that's going to support your back. If you're doing 3 12s in a row, I mean, your back's gonna be dying at the end of the day if you have shoes that are not supporting you. So in my opinion, I think it's better to shell out some money for supportive shoes so that your back and your legs thank you. One other thing on shoes, a sturdy toe is good with your shoes, just because there's lots of rolling, moving parts. Patients can accidentally step on you. You can get rolled over with a bed. You can get stepped on by someone else. It's just best to protect your shoes and make it so nothing can fall on them. If you drop like something very breakable or like a needle, anything like that that could actually hurt your toe, if you have a hard toe on your shoe, then it'll bounce off and nothing bad happens. The next thing that I did not jump on this until I got pregnant, and that makes me so sad, is compression socks. So I always thought, oh, compression socks are for old people, but that's because old people don't give a crap what you think, and they just want to like be comfortable and have legs that don't hurt. So be more like old people and go get yourself some compression socks. I have Sockwell compression socks. They are, let's see if I can lift my leg up here. Sockwell compression socks. They go all the way up to my knee. I will link them down below. So when you're standing that much, obviously all your fluids are just gonna kind of sink down to those legs and they're gonna hurt. They're sore after a whole day. But if you're wearing supportive shoes and you have these socks that keep the blood flowing in those legs, I mean, I saw a huge improvement in my leg pain. I was astounded, and now I will never go to work without them. I love them. They're like 20 bucks a pair. So again, I have 3 pairs I work for when I work 3 days a week, but I'm thinking of getting more for even clinical, because the more I stand at clinic, my legs hurt there too. So I'm just going full on compression sock mode and going for it, bracing my inner elderly. The next thing are scrub pants. So scrub pants, what you're gonna wanna find in scrub pants is not the scrubs that make your butt look really good or that are super stylish and hug everything and make you look great. No. You're gonna want scrub pants that you can move in and that are gonna be really utilitarian. So think like cargo pants. You're bringing them back, okay? You're gonna want pockets. You're gonna want this thing, how you have like the little loop, so you can hang your phone on it. You're gonna have to put papers and pens, all that goodie in your pockets. You're gonna want a couple of pockets. I have ones by Koi. They have 2 big pockets where you have normal pockets. They have 2 big butt pockets that flap shut. They have a side pocket on your both legs, which is great for putting like your nursing brain or something in there. Pockets, pockets, pockets. You don't want them super tight fitting because you're gonna be squatting. You might be jumping on beds. You never know what you're gonna be doing, but you need to be able to move, and you don't want to worry. I have literally seen nurses bend over and their scrubs bust open. You don't want that, I promise. You want to be able to comfortably bend without worrying if your underwear are going to pop through. That person you're trying to impress with your tight pants is gonna be way more impressed when you leap up on that bed and start doing CPR in your very comfortable pants, and then they're gonna ask you out rather than when you bend over to empty a chest tube and your pants split open. I promise. I'm not wearing one right now, but you're gonna wanna wear a light jacket. So layering is the key to the game when it comes to your nursing outfit. You're just gonna wanna dress in layers because you are gonna go from being hot to cold. So hospitals are never the perfect temperature, and if you're running around, you're gonna be hot, you'll wanna take that jacket off. But then when you're sitting for a minute, maybe charting, you're gonna be cold. Night shift especially gets kind of cold in the middle of the night. So just wear layers, that way you can add and take away as you need and you'll be more comfortable. And you won't have to be one of those people that is going into the blanket warmer and huddling up with the blanket warmer, because that would make me fall asleep. And you kind of look like a homeless person walking around the unit. Not the most professional thing. Finally, when it comes to clothes, you're gonna wanna bring a backup pair of scrubs. These don't have to be your favorite scrubs, your most comfortable pants. Whatever it is, you're just gonna wanna bring a backup pair, put them in your locker, and those are for the days when catastrophe strikes and you get some bodily fluid that is not your own all over your body, and you're like, I can't hang, and you need to wear something else. You're gonna be so happy you have a backup set of scrubs in your locker. It makes you feel like a whole new person rather than walking around the rest of the day with goodness knows what all over your body. Tools. Okay, so what are you gonna wanna have on your actual person? You're gonna, not a whole lot, because like I said, you're gonna accumulate things over time and you just wanna be as mobile and as free as possible. So one thing, pens. Get clicky pens. Don't get the ones with the cap, because you aren't gonna wanna sit there and have to open, close, even like bite it up. No, that's gross. You don't wanna lick things in the hospital. Click, right, done, perfect. Not gel stuff, because that can smear, and then make it black or blue, because you wanna be able to whip out any pen that you have and sign things, and you can only do that in black and blue. So while colors like pink, purple, all of that might sound really appealing, I've found that it's more annoying to like rifle through your pocket to find the pen that you can sign things with than to have the cute pen. Another thing you're gonna wanna have in your pocket at all times is chapstick. Bring like 3. Hospitals are so dry. They suck the moisture out of you. You walk in and it's like, bleh. You become those people from like The Princess Bride where it's like sucking the life out of you. It's happening to your lips. I always have a couple chapsticks because then they go missing, and just always have some chapstick on hand. You will apply that stuff all the time. Food and beverages. Bring a water bottle with a lid that closes. Save the planet a little bit, and it has a lid that closes, which makes the powers that be happy. You're gonna wanna bring some easy snacks. So sometimes it's really hard to get any food in your body during a 12-hour shift, and that's a really long time to go without food. Bring like granola bars, things that are gonna be really easy to shove in your face, something with protein, kind of some carbs, pick you up. Have a couple, have them available, because sometimes you get to the point where you go to sit down and all of a sudden you are just like, I'm gonna faint, I am so hungry. You just need to shove something in your mouth real quick and be able to keep going. It's kind of like you're a toddler. Be kind to your peers and get yourself some gum and mints. Before you give a report, before you do anything, we're gonna be talking to a bunch of people, have some gum, pop a mint in your mouth. Your breath is always terrible at the end of your shift. I know some people who brush their teeth, that is like way too much for me. So I just always have like a piece of gum, chew some mints, do something to get rid of that 12.5 hours of coffee that I have been ingesting so that I don't kill the person that's coming on and relieving me so I can go home. And last, I always think it's a good idea to have like Advil, Tylenol, something like that on hand so that if you start to feel like garbage, you get a headache, anything like that, you have a way to fix it, because there is nothing worse than going through your day trying to take care of other people while you feel like there is a jackhammer going off in your head. All right, so those are my 10 things I think are absolutely essential for all nurses, nursing students, anyone who's gonna be doing clinicals on the floor. Help you be your best self throughout the day so you can provide awesome care for others. If you like this video, thought it was helpful, give it a thumbs up. As always, if you have any other questions related to nursing, anything like that, please let me know in the comment section down below. We will see you next time. Bye.